morning, everyone. Thanks so much for joining our webinar today. We appreciate all that you're doing on an ongoing basis to respond to this situation, and we appreciate you taking the time to talk with us this morning. We just have a few updates that we want to go through with you. We know that we've got new people on the line today that weren't on the line before, so we're going to do a really abbreviated review. For those of you that have heard this information multiple times, you get another 5 minutes to look at your email, I guess. But I'm going to move quickly through these first few slides and just want to make sure that everybody's got the same baseline knowledge going into these discussions today. I apologize, I should introduce myself. This is Ann Garvey. I'm the Deputy FBA here at the Iowa Department of Public Health. And also speaking on this webinar today is Ken Sharp, who's our Division Director here at IDPH. So as with all of our webinars, these will be recorded and archived, so all registered participants are going to get a link to view this webinar at a later point if you need to miss some of it, or if you want to share it with others that weren't able to join today. In addition, you'll get a copy of these slides. We are starting to post webinars on our website, but we are only planning to post the topic specific webinars. So for example, the businesses, the schools, the long-term care, the child care, and the law enforcement. We do not plan to post these webinars that we hold with our Healthcare Coalition partners on our website. And as always, if you have questions while we're moving through the presentation, please feel free to enter those in the Q&A box, and we'll move through those at the end of the presentation today. So again, the goal of these weekly webinars is to carve out a time in which we can give you updates on what we're doing here at the state level, any changes to guidance, any planning considerations that we recommend you make at the local level. And then also we want to hear from you. So it's important, if you're having challenges, issues, questions at the local level, please enter those in the Q&A box, and we'll work through those again at the end of the presentation. These weekly webinars will be every Wednesday at 10 a.m. So please mark your calendars for the foreseeable future. And we'll be sending out links for each one of these with the follow-up information from the previous week's webinar. It does take a little bit to archive these webinars, so it won't be an automatic right after the conclusion of this webinar, but by the end of the day today, you should have the follow-up email with a link to register for next week's webinar. All right, I think that concludes kind of the housekeeping discussion, so we'll move right into kind of the body of what we want to present to you all. Again, we're going to do a really abbreviated review of COVID-19, the traveler monitoring, the healthcare screening, the patient testing criteria. We're going to remind you where to find communication resources, and then Ken's going to talk about healthcare supplies and assets and coordination. So as we all know, coronaviruses are a really large family of viruses. And some of these viruses only infect animals, some infect people, and some infect both. And I think that we are making headway on trying to dispel some confusion related to common coronaviruses, but I'm sure you're still receiving questions at the local level. So it's important to make sure that we're communicating to the public that there are 4 common coronaviruses that circulate very regularly, especially this time of year. They usually cause more mild, self-limiting illness, respiratory illness, and most of us have been infected with at least one of these 4 common viruses at some point in our lifetime. These viruses are detected on the panels that are commonly done in health facilities. So if someone says they went to their healthcare provider, they were tested because they had respiratory symptoms and they were coronavirus positive, they're talking about one of these common coronaviruses. Now, there's 3 more rare viruses that have been shown to cause illness in both animals and people, and that's MERS-CoV, SARS, and this COVID-19 virus. As we know, these illnesses can cause more severe pneumonia and life-threatening illness, and these would not be identified on our standard respiratory panels. We'll talk about this more later in the presentation, but again, the only place in Iowa that can currently do testing for coronavirus for COVID-19 is the State Hygienic Laboratory. So any other panels that are being done at healthcare facilities across the state that are identifying coronavirus are identifying these common strains. We know that this virus was first identified in Wuhan in the Hubei province in China, but is now spreading person to person through many communities across the world. Here's our updated dashboard from the World Health Organization. This was just updated this morning, so we have over 93,000 cases, over 3,100 deaths in 77 different countries around the world. So you can see that the spread increases on a daily, if not hourly basis. We are starting to see the numbers in China stabilize, but as you are seeing by this map and seeing in the media, the numbers in other areas of the world are certainly going up. And again, we all know that this is a rapidly evolving situation, but I really want to emphasize that the guidance is changing on an hourly basis. We're getting new information from our federal partners, from the media, and so we're having to be flexible, and we appreciate that you're all being flexible as well. Here's our most recent numbers within the US, so 60 cases in 12 different states. We have not identified anybody infected with COVID-19 yet in Iowa. We're updating our numbers of people being tested and people being monitored every Monday, Wednesday, and Friday. So here's what we currently have posted on our website. And this slide is a really important slide, and I'm going to reference back to it in several points later in the presentation. CDC keeps a very good table of where locations are seeing widespread and sustained transmission of COVID-19 around the world. And you'll see that they're also issuing travel health notices for these impacted countries. So when we're talking about areas affected by COVID-19, we're talking about the countries that have level 3 and level 2 health travel notices in place. We know that the list of countries that are having these travel notices is going to change on a frequent basis. And so we are going back and updating all of our guidance to just include a link to the CDC page that has this chart so that people can make sure that they're accessing the most up-to-date information at the time in which they're reviewing that guidance. So again, from this point forward, when I talk about areas affected by COVID-19, I'm talking about countries that have level 2 or level 3 travel health notices in place. So we were notified very late yesterday that we are going to start receiving information on travelers returning to Iowa from Iran. We sent out a HAN to our local public health partners as soon as we received that information. We're going to use the exact same process that we're currently using for travelers returning from China. We don't expect to receive a large number of people returning to Iowa from Iran. There are travel restrictions in place for Iran, so it would be primarily US nationals. So again, we don't think this is going to impact our numbers, but we want to make sure that everyone knows that Iran and China are places where we're going to be doing the formal monitoring process, which would include notification from CDC and putting these people under public health orders. At this point, we are not aware that this formal monitoring process is going to extend to any additional countries. As you know, that could change, but as far as this point in time, we don't have any indication that we're going to extend that beyond Iran. So again, the way that these individuals are being identified and screened is that all flights that are coming from China and now from Iran are funneled into 11 airports. If people have symptoms, if they're sick upon arriving in one of those 11 airports, they're stopped and they're assessed by healthcare professionals, tested if needed, before they're allowed to continue on to their destination. If they're still well and not having any symptoms, then all of the contact information for them, that individual will be collected, and then it's sent to our department through a secure communication system that we use frequently for ongoing communication with CDC directly. Anyone assessed to be at high risk will receive the high risk voluntary home confinement order, which mandates them to stay homes for 14 days after they left that area that's under a current travel advisory. The medium risk, the only difference in that order is these individuals are allowed to go for a walk, go for a jog, ride their bike, non-congregate activities outdoors. And the low risk, they're issued an order to submit to self-monitoring. Again, with all of these orders, persons are required to follow up with public health twice daily to make sure that they're still fever-free, that they don't have any other respiratory symptoms. With that low risk order, there's no restrictions on day-to-day movement. These people can go to work and school. They just need to coordinate with us prior to leaving the state or traveling long distances. So yesterday we pushed out recommendations for all other people returning from COVID-19 affected areas outside of mainland China and now Iran. So again, when I say affected areas, I'm talking about this table. So China and Iran we're monitoring, obviously, as we just discussed, but this new recommendation would include Japan, South Korea, and Italy. We pushed this recommendation out in response to a lot of questions that we were getting, and we wanted to be very clear with returning travelers that we're asking you to isolate yourself for 14 days after you return home. If you get a fever or respiratory symptoms, contact your healthcare provider, notify them of your travel prior to going into the medical office. Your healthcare provider can then give you advice on whether you need to be seen in the office based on your level of illness. And if you do need to be seen, can give you special instructions to follow to make sure that other people aren't exposed in the office when you are getting that healthcare assessment. So again, this communication we pushed out yesterday. Late last night, we did get indication that CDC is pushing out similar information, so we're going to be in line with that. We do know we've got feedback from several of our local public health partners that there was some confusion, that the press release wasn't as clear as it could have been, related to that we're still going to do the mandatory monitoring in China. So we've tried to address that with a fact sheet that's now posted on our website. We're updating it now to make sure that it addresses Iran. But again, we appreciate your feedback. We appreciate your suggestions. That helps us make sure that we are creating the most clear guidance that we can. Thank you for that. We do know that we may not always get it perfectly right the first time, and we might need to make adjustments, and we appreciate your patience and your cooperation. We all know we're in this together and want to work jointly with you to make sure that we're communicating things as clearly as possible. So I'm going to transition and talk briefly about the screening that we're recommending that all healthcare professionals institute either prior to or at patient registration. We're still recommending the screening questions be asked, the same screening questions that we discussed with you last week. Do you have a fever or respiratory symptoms? Did you travel from an affected area? Again, affected area, we're talking about those same locations that we've been talking about this presentation. So if you've traveled from one of those areas within the 14 days before you get sick, and did you have close contact with a lab confirmed case of COVID-19 in the 14 days before you got sick? So those are the three questions that we want to continue to be asked at healthcare facilities. The listed countries here on the slide are only current as of this moment. So again, we would encourage you to make sure you're referencing back to that CDC page frequently. Now, we have gotten some feedback that people are confused. They think that if you screen positive, then you're automatically going to get tested, and that is not the case. So what I have on the slide is the national testing guidance. So we have to abide by this testing guidance in Iowa because that's what the EUA, so the emergency use authorization, that the laboratory test itself is approved to be used for. So we have to stick with this testing criteria. So even if patients screen positive, We still want the healthcare provider to use PPE to go in and assess the patient, to collect the additional information that we've talked about in previous discussions and that's outlined on the healthcare provider guidance that's on our website, and then consult with us and we'll talk through whether the patient meets any of the testing criteria. And again, the testing criteria are if someone has a fever or respiratory symptoms and had close contact with a lab confirmed case in the 14 days before they got sick, anyone with fever and respiratory symptoms who require hospitalization. So again, we are just testing the most severely ill persons and who had a history of travel from an affected area. Again, same definition of affected area within the 14 days prior to symptom onset, or someone who had fever and acute lower respiratory illness like pneumonia or acute respiratory distress syndrome that requires hospitalization and we do not have an alternative diagnosis for. We can test those individuals even in the absence of the exposure to a confirmed case or the travel history. So again, these are the national testing criteria. This is what we have to abide by. We are very aware that there is some news in the media saying that anybody can get tested by just going to their healthcare provider. And we do know that that's going to complicate things moving forward. But at this point, we are not changing from this testing criteria because we have a limited number of test kits and we've received no guidance that we need to change that or alter our procedures. So regardless of what you're seeing in the media and seeing announced by individuals, we are not opening up testing to anyone who wants testing. We are sticking with this testing criteria. In a perfect world, we would love to test anybody that wanted testing. We don't have the laboratory resource to do such, and we don't want to overrun our healthcare facilities. So we've also gotten a lot of questions about what do we mean when we're talking about social distancing, and I think that you're all far more familiar with this concept than others, but I want to take a few minutes and talk through it. When we're saying social distancing, we're really emphasizing that it's important to stay at least 6 feet away from other people. So that might include canceling K-12 schools or college classes or asking daycares to close. It might include canceling events or large meetings, non-essential travel, encouraging people to work from home as that's possible. And on our business webinar, we encourage businesses to kind of think outside the box. And if they provide services, for example, restaurants, consider expanding their carry-out services. If we got to a point where we as public health, so that's us and you jointly, are recommending social distancing in specific communities because we're seeing spread of COVID-19. So we encourage the businesses again to think about ways that they could continue to provide services in a way that was consistent with social distancing concepts. So again, expanding carry-out services. If they are going to seat people, spread out the seats within the restaurant so people are not sitting close to each other so we can maintain that 6 feet distance. For customer service, we know we're going to get a lot of questions about can we still have checkers, for example. We're recommending that those individuals use frequent hand sanitizer, perform frequent hand hygiene. We're not recommending using a mask and just expanding that distance from customers as much as possible. So I think that some people in the public think when we say social distancing, we mean nobody can leave their home, and that's not what we're saying. We're just wanting everyone to do everything they can to expand that distance that they're maintaining from others to at least 6 feet. And we know that's not going to be perfect, and we know that everyone's not going to, be able to abide by that, but we want people to do the best they can to follow that guidance. We're also getting a lot of questions about when are we going to recommend social distancing? What's the trigger? And there's not going to be a black and white answer on this. It's going to be based on what we're seeing for activity, COVID-19 activity in the community, and what aspects of the community are being impacted. And so we are going to be working very closely with our local public health partners to assess what is happening as far as virus transmission within the community and make the best recommendation that we can based on the information that we have. And we expect that this recommendation for social distancing is going to be community specific. We don't anticipate that we would automatically say there's virus activity in one part of Iowa, so we're going to recommend social distancing for the entire state. Again, we expect this to be a community-specific recommendation, and we're going to be working closely with you as local response entities to make sure that we're communicating that information, that we're sharing information, and that we're pushing that guidance out to the public. We have a lot of different guidance documents on our website. I know a lot of you have joined the webinars we've been doing the last couple of days. We appreciate that. And we've got a few more coming up. We've got long-term care this afternoon. We've got our EMS webinar tonight, and we've got law enforcement tomorrow. We're also in the process of creating several more general presentations that can be used for the healthcare community as a whole. We're going to post a link to that on our website so that healthcare providers can view that at their convenience. We're also going to create a similar type of posting for local officials that Ken's going to talk about some of the policy issues and things that local officials need to keep in mind. I did just include the number of registrants for our webinars to give you a sense of how we're reaching folks. I think that we've had great participation. We've had great questions to date, and we're hoping that it's helpful in your communication with entities in your jurisdiction. I also want to make you aware that our HAI team, so our Healthcare Associated Infections and Antibiotic Resistance team here at the department, and that's 3 people. It's Nancy Wild, Tyra Goss, Lisa Vitale, are working to contact all of our long-term care facilities to make sure they've seen that long-term care guidance, that they understand it, and that they don't have questions. To date, there's over 400 long-term cares in the state. To date, they've reached over 220 of those, and so we're making our way through the list. We hope to have that finished yet this week or early next week. And when we're contacting those long-term cares, the good news is almost all of them already have the guidance and have looked at it, and that's due to some of them got the guidance when we sent it out via the information on EM Resources, but I think what's even more impactful is when you, as their local authorities, send it out as well, and many of them are saying, oh yeah, I got it from my local health department. So thank you so much for all of your coordination work to continue to do outreach with the long-term care facilities. We are very concerned about long-term care facilities. This virus seems to be impacting our elderly populations and populations of people who have other comorbidities most severely. And so we want to make sure that this sector of our healthcare community is prepared. They have the guidance, they know who to call if they start to see illness within their populations. We know this is complicated because we're also seeing high levels of flu right now, but as we're getting reports of influenza clusters within long-term care facilities, we're making sure we're doing testing to confirm that it's influenza, not another pathogen. So again, thank you for all your ongoing efforts to reach out to your long-term care centers. That's important work, and we certainly appreciate it. We're getting a lot of coronavirus calls on a daily basis here at the department. As our local public health partners know, we're about a month into this response, and we're seeing a steady increase in the numbers of calls that we're getting. We're certainly getting a spike today with all of the discussion about expanding testing. Again, we're not expanding testing. And so we appreciate all you're doing, because we can only imagine that you're getting an extremely large volume of calls to your offices as well. These calls are being answered by our field epidemiologists, so that's your preparedness money at work there, and also some additional epidemiologists in CADE. Polly Carver-Kim has been doing an incredible job making sure that she's updating documents on the website, communicating with our media, creating infographics for us to use. Again, we are only updating the numbers of people being monitored and tested on our website every Monday, Wednesday, and Friday. We are not identifying where in the state those individuals reside. We always want to balance our patient privacy with giving as much information as we need to protect the public health. If we did have a case, obviously we're going to be announcing that more quickly. We're going to think about what type of geographic distribution we're going to include in that announcement. And so those are all things that we're planning for at this point as we see the spread occurring in the US. Polly's been pushing a lot of information through social media. I'm sure you're all familiar with our Twitter and Facebook handles. We'd encourage you to look at that. We've got several infographics available. The Preparing for COVID-19 is the newest version of the infographics, and I know Polly's got one or two more in the works. So continue to be on the lookout for those communication resources, and we'd encourage you to use them as you find them helpful in your communications with your jurisdictions. Polly's information is listed on this slide, and again, don't hesitate to reach out. All of our communication resources are posted on our novel coronavirus or COVID-19 webpage, and so we'd encourage you to check back to that page frequently. That's where we're posting all of our resources and our guidance and documents. We're also posting the links to those archived webinars on that site as well. So at this point, I'm going to turn things over to Ken to talk through some resource and coordination.
Great. Thanks, Dr. Garvey. I appreciate your time this morning. So we want to spend a little bit of time talking about some resource availability work that we are implementing through our Emergency Command Center. One of the things that we are navigating, we've got a number of requests and an increasingly number of requests each week regarding PPE availability. So one of the things that we want to reiterate that we had shared on previous webinars is that the amount of PPE that the state has in terms of a stockpile that we have control over is limited, and it can certainly not meet all of the PPE shortage needs that we might anticipate. So in anticipation of trying to make priorities and decisions about when we can release that material or those supplies, we will be working on a process for requesting those state resources in response to this outbreak. That document that outlines that process we anticipate will be released later this week and posted on the HON. And I'll mention as well at this point, I think I'll revisit it in another slide. We have on the HON created a document library folder specifically to COVID-19, and many of these resources will be posted there. We have also, in response to requests from CDC as well as the governor's office, been looking at collecting weekly information related to bed availability and other supplies, particularly PPE. The Have Bed updates will be sent out on Thursdays at 10 a.m. and ask for a noon deadline. We also sent out a PPE survey yesterday. We recognize, we've heard from several of you, the burden that survey has presented. We will continue to work on acknowledging that burden and trying to find resolution to managing those requests for information that we're sending out to you. Our challenge here that we're trying to navigate is we recognize the state resources are very limited and we cannot fulfill all of the requests for PPE that will likely be coming from the state stockpile. It just simply is not that robust to be able to support that. The other challenge is our knowledge of what the federal assets are is relatively limited. So we don't have strong assurances that if we are unable to fulfill those needs, that we have assurances that are in place that the federal government can meet those needs. So we do have to look very closely within our state about resource availability and distribution as it currently sits. We also want to clarify that the request that was sent this week is a request for baseline data. It is looking at some of the older aged PPE that you have in stock. We expect future requests to be more condensed, and we just ask for your patience as we move through this. These requests are in direct response, as I mentioned earlier, from CDC, also trying to gain a national perspective on this, as well as state planning purposes with the governor's office, with State Homeland Security and the Department of Public Health. So we appreciate your patience. We're asking you to do your best. We recognize that this is a burden. We apologize for that inconvenience, but we think it's important information for us to have as we look at statewide availability of resources. This slide is a repeat from what we discussed last week. Again, what's encouraging from our perspective is as we've reached out to the long-term care facilities, it's clear that many of you have already reached out to a number of your partners. Just a reminder of some of the activities that we're asking coalitions to do under that Goal 1 function. I'm not going to spend any time on that. The next thing we want to talk about here is just some additional ideas for you to be thinking about how to continue to build on that work that you've done with, for example, the long-term care facilities. For those of you that do not have the healthcare coordinator position in your agency, remember that healthcare coordinator position is a local resource that can help educate and inform local partners and coordinate those resources across the counties in your coalition. So call on those folks. They've got phenomenal expertise and they can make some of those connections to help navigate those resource needs and discussions at the local level. The other thing, and Dr. Garvey has reiterated this a couple of times already, I just want to reinforce this. Information from CDC changes frequently, and as a result, our information changes frequently, literally on a daily basis. Our recommendation is, as you think at the county and the coalition level, I would develop a plan for regular review of the websites and HON folders. I will reiterate again, there has been a HON folder created that we are dumping everything into. One of the things I also want to clarify is that Dr. Garvey had mentioned that on our website we have some of the outward-facing webinars posted for things like businesses, schools, and others. However, in the HON folder, the Healthcare Coalition webinars that we are doing weekly will be posted there for future reference and future viewing. So you can go into the HON folder and pull those out. We also want to encourage you to think about, one of the things that we're struggling with is we are getting requests daily for additional webinars for very specific audiences. So for example, I had a request yesterday, can you do a webinar for banks or financial institutions? We just simply do not have the breadth and capacity to do that level of specificity for a briefing document, or I'm sorry, for a webinar. So one of the things that we're asking the healthcare coalitions to do, like you have done with the long-term care facilities, is look at how you can use those existing resources on our department website, particularly the links to the outward-facing webinars for businesses, schools, and those kinds of things, and do what you can locally to make sure that your local partners, your business partners, your daycare partners, your schools, and others have the ability to address those needs and share that information. The other thing that we mentioned is that we do have the HON library. It has been opened. It is titled COVID-19. If you have not logged on to HON in a while, I would recommend that you refresh your experience with that and your familiarity with the HON. Resources will include things like the educational and fact sheets, the communications guidance, the healthcare resources, the webinar recordings, EMS resources, other talking points, and those types of resources. So please continue to think about how you can leverage those resources and share those locally. Take advantage of Polly's tweets, Facebook posts, and those kinds of things, and get that information out. The other thing, just a reiteration, one of the things that we are continue to struggle with, we're getting a number of calls directly from a variety of providers for PPE shortages. We want to make sure that folks reach back to their healthcare coalition first, have gone through some criteria to evaluate what resources may be available through the coalition, and then if not available there, we need to have those resources requested through the county emergency manager and posted into the Web EOC event. There is a Web EOC event that has been opened as of last week. I will just reiterate, however, the accessibility to that is limited, and it is limited only to county emergency managers and a select few state agencies. So public health agencies, as a general practice, will not be able to see that event directly, but we will have that available to county emergency managers. Okay. We are having a fire alarm go off at the department here and asking for an evacuation. So I think what we will need to do in order to ensure our own safety, we have the questions that will be documented. We will take those questions and write out, we will work on addressing those through various fact sheets or other mechanisms. I think we're going to be hesitant to go to specific answers for each individual question. We'll just make sure that those are addressed in our respective fact sheets. So with that, we're sorry to have to adjourn this so quickly. We do appreciate your patience, and we will look at those questions and provide some guidance as we see appropriate in response to those questions. Our apologies for having to ending this so shortly, and we will. Okay, Ann's going to go check to make sure there's not smoke somewhere. We may ride this one out. Okay, folks, I'm sorry, we do need to go. What we will look at doing is perhaps doing a second recording with the questions, review those, and tag that on as a part of this webinar link for the future. Our apologies for having to cut things short. Thank you for your time this morning. We greatly appreciate it, and we'll talk to you again next week. Thank you.